Hi, I'm Doctor Veda, and it is very nice to meet you. Today you're here for a full face examination and face mapping, is that correct? Perfect. Now, have you ever had this done before? Okay. Well, basically, the overall goal is to improve the health and appearance of your face and skin. It is a very detailed and thorough examination. It takes a little while. Often we do some treatments during the procedure, and it's not intrusive at all, not painful. It just takes a little while, okay? Perfect. So usually I start by looking at the different areas of your face and taking some notes about what I'm seeing. I will use a couple different lights during this procedure. So just to tell you, I usually map the face out in some different sections. The first one being your forehead, second being the glabella region between your eyebrows, third would be temple and eye, and then fourth would be your other eye and your other temple. Fifth is your nose. Sixth is going to be cheek. 7 is your other cheek. And 8 is your mouth and chin area. Okay. The reason for this is that it helps me keep track of what's going on in the different segments of your face. And sometimes you even need different treatments in different areas most of the time. Alright. So I'm going to start by coming in, taking a look at your face. This is just the first part. I'm not going to be touching you at all during this part, okay? I'm just going to come in, and I have this magnified light to help me, okay? So I'm going to start with section 1, which is your forehead. Alright. So in section 1, I am seeing some fine lines, a bit of dryness. Okay. So that's pretty typical. I'm going to note that down first. Section 1, fine lines, dryness. Coming back in. So we don't have any redness. That's good. Do you tend to sunburn easily? Okay. Do you wear an SPF? Good. Alright. Now I'm gonna move down into your glabella. And yeah, I'm seeing same thing here, the fine lines and the dryness. Have you tended to have oily skin or dry skin throughout your life? Or combination? Okay, generally combination skin, okay. Alright. So I can already tell for your face that we're probably going to need to use a combination effort where we treat some of the dryness and very small minimal signs of aging, and also maybe some of the oily issues. I'm seeing the little bit more oils on your cheeks. So just come in here. Okay, looking at your temples and eyes. Temples, nothing of note there. And can you go ahead and close your eyes for me? Okay, thank you. Just looking at the skin on your eyes. Eyelids are a little bit oily. Looking really good though, very, very minimal aging. And you're really lucky. I don't see much darkness underneath your eyes at all. Yeah. So your eyes need very little. Do you use an eye cream? Okay. If that tends to work for you, you can keep using that. I don't think you need any special cream or serum for the eye area. Just a little bit of oiliness on the eyelids. Sometimes with that, if you wear eyeshadows, we would suggest a primer just to make it stick longer, but in terms of health and appearance, it looks really good. I don't think you need to do much there. And I'm just going to look at your nose now. Okay. Bridge of the nose looks really good. Okay, I do see a little bit of oiliness on the nostrils. And very, very common, some redness around the creasing of the nostril. But that's very common, not a sign of any ill health at all. But we can definitely give you something that might help with that. Do you ever tend to get acne on the nose? Okay, good, yeah. So you don't really need much in this area. I don't even see any extractions that need to be done, really. So we don't do extractions during this procedure. Okay, I'm going to come into your right cheek first. Right. So for your right cheek, it looks good. I'm seeing a little bit of oil buildup around the outside of your cheek, more so, and actually some very small bumps that could be, looks more like whiteheads than milia. So there's a couple causes for that, especially where I don't see that on the rest of your face. Definitely want to note that. They're very small, not anything to really be concerned about, but in terms of if we're looking for aesthetic perfection, there's something that can be done about that. So very small white heads. And coming down into your right jaw. Looks good down there. I'm really not seeing anything of concern. Again, it's just mostly in this area on the side. Now, left side. Very similar. Cheeks look really good. You have very even pigmentation. This is a lot of the time where we see potential rosacea, but you're looking very good in that aspect. And same thing, but not as prevalent over here with the little tiny whiteheads. So it's going to be more so on the right cheek. And I think I know exactly what is causing that. So let's get back in here. Okay. Mouth looks good. I'm not seeing lines around the mouth. You're not a smoker. Okay, didn't think so. Generally, if somebody has been smoking for a while, we see a lot of little lines all around the mouth. That can also happen if you drink through a straw very frequently. If you're pursing your lips like that a lot, you tend to get little lines around the mouth, but that is not an issue for you. And down into the chin. Chin looks really good. A little bit of oil. Do you ever tend to break out in your chin? Occasionally, okay. So, in terms of breakouts, I am seeing around the edges of the face and then potentially the chin. That's also where you're a little bit oily. Bit of oil on the nostrils and some redness in the crevices of the nose, forehead, a little bit of dryness, fine lines, and same with glabella. So really nothing concerning, but definitely stuff we can address for you. Okay, just put this aside. Now, what I think is probably causing the little bit of acne I'm seeing on the sides of your face. Do you talk on the phone a lot? Okay. And do you tend to usually talk with it on your right side? Okay. And what side do you sleep on? Alright. So, to help prevent some of that, you need to start cleaning your phone more often. So, just wiping that down with a phone cleaner or an alcohol swab or anything like that. Or you could use one of those little the sanitization pods, like the little UV sanitization pods at night, and that will help with those breakouts around your face. And also, I'm sure you wash your pillowcases, but washing them a bit more often could really help. Maybe even changing them out a couple times a week, especially right now where we're in the initial stages of treatment. And then once that's cleared up and you don't continue basically reinfecting yourself, we can cut back on that. So I also would recommend using a silk or satin pillowcase. Do you use one yet? Okay. They're very affordable. You can find them a lot of stores, Target, TJ Maxx, order on Amazon if that's your thing. And the reason I suggest that is because they pull a lot less on the skin and also on the hair, so it can help with signs of aging, those very fine lines that we're seeing. And if you were to get a couple of them and rotate through them throughout the week, keep them nice and clean, it's going to help with very minor breakouts too. Okay? Alright, I'm going to go ahead and move on to the next step of the process, which is to take some pictures of how your face currently looks, okay? Alright, let me just go ahead and grab my camera. Okay, so the camera here. It would help if I took the lens cap off, I'm sure. And I'm going to take some pictures of your full face, and then certain sections I'll be far away, I'll be close up. This is just getting a full picture of what your face looks like before any treatment, okay? Alright, so first picture, you don't have to smile or anything, just neutral, and I'm going to go ahead and take the pictures. Good. Okay. I'm going to come in for this next one. Get a very, very close look at your forehead. Good. Alright. Let me just zoom in a bit. And cheeks. Very good. Your other cheek. Good. Nose. Good. Alright, come nice and close on your chin. Good. Okay, now if I could just have you go ahead and turn your head a bit to the right and get a very good picture of your little bit of acne. Thank you. Okay. And same thing, head to the left. And just another little picture. Very good. Okay. Looking great. Alright, another full face. Good. Full face, turn to the right. Good. Full face to the left. Good. Okay. I'm going to put this back. Okay. So pictures are all done. And the reason we get those is so that when you come back in for any follow-ups, we can compare the condition of your skin at that time to how it looked before you started any treatments, okay? Perfect. Alright. That really just helps us know if we're on the right track with everything, if everything looks good, if we need to make any modifications. So the next step is going to be measuring your face. My little tape measure here. And I'm just going to get some measurements, okay? So I'm going to come in. Still not touching you. Okay. And we'll get the width of your forehead first. Width and height. Good. Alright, now I'm going to do your nose, just the length of your nose. Okay, and the width of your nostrils at the widest point. Good. And I'm going to do the bottom of your eye down to the edge of your jaw. Good. And left side. Okay. Very symmetrical. Was the traffic pretty bad when you came in? You hear a lot of cars outside. Yeah, it can be bad this time of day. Alright, I'm going to do the width of your lips. Good. The height of your lips. Okay. And just bottom lip. And just top lip. Alright, with height, bottom, top. Excellent. Okay. Now I'm going to do from the edge of your nose to edge of your cheek. Good. Other side. Good. Right side. Centimeters. Left side. Centimeters. Okay, now I am specifically measuring just the area with those little tiny whiteheads right now. We are very hopeful that those will be either non-existent or at least have shrunk the next time you come in. Okay, right side first. Okay, just get in here really close. Good. And left side. Alright. Good. And like I said before, right side is a little bit more significant than left side. Still both very mild. Right side. Left side. Okay. And I'm going to just do the width of your chin. Good. And from the bottom of your chin to your bottom lip. Okay. And I'm actually going to come in. I'm going to see your sort of longest fine line on your forehead. If I can pinpoint it. So I'm looking for the longest fine line on your forehead. Okay, let's say this one. And I'm going to measure just that longest fine line. Okay. Very small. Okay. So, perfect. We are good with measuring. I will set this aside. And now I'm going to put on some gloves because I will be starting to just touch your face a bit. Again, nothing painful, I promise. Okay. So how did you find our practice? Oh, yeah, I love them. That's great that they referred you here. Okay. Awesome. Alright, so these are just basic blotting papers. I'm going to use these on the different segments of your face to see where you have the most oil production. Just so I know you didn't wear any makeup or anything. We have no face lotion on, nothing. Perfect. And what time is the last time you washed your face? Excellent, okay. So we have a little while for some oil production to have built up, which is good. Alright. So I'm going to start by just swabbing this across your forehead. It's just a little piece of tissue paper. It does not hurt. It'll just pick up the oils, okay? So we'll start with section 1. Alright. There we go. There's 1. And section 2 is just your glabella. And to keep in mind, just so we get an accurate representation, I know your forehead is much larger than your little glabella, so I'm just doing a very small section to keep them all pretty equal. Alright, so just in here, glabella. Good, okay. And as I could kind of see, both of those have almost no oil on the middle, so. Alright. Now I'm really going to stick to just the temples. Good. Tiny bit of oil there. And left temple. Good. Same there. Okay, and nose. Now I'm gonna do just down around the nostrils, because that's where you do have a bit of oil, okay? Alright, yep. And right cheek, I'm going to do right where you have that little bit of acne. Just a bit of oil there. Left cheek. Good. Same thing. And chin. Okay. So really, the only parts of your face with any real measurable amount of oil are going to be your nostrils and chin. So that is where we would look into more of an oil reducing treatment. The sides of your face with a very little bit of acne don't really have much oils, so we don't need to worry too much about that. But I think pretty much the same thing we use for the oil production, we're going to use for that acne. So you would have a similar treatment for both of those. Okay. Alright. Now the next thing we're going to do is a couple of different swabs. I'm going to swab all of the different sections of your face, and we will go ahead and send them to the lab for testing. So I have these little swabs. I'm just going to take a little tiny swab of each of the 8 sections. I will be putting them in these tubes, and we will get them to the lab, okay? So let's just get that ready. have my 8 tubes ready. Get that off there. And I'm going to come in and start with just your forehead first, section 1. Good. Put that in there. Snap that off so I can get the lid on. And we'll set that aside. Okay. Now, glabella. Very good. Okay. Put that in there. And don't worry, I have them in a little labeled holder over here, so we won't get them mixed up. Section 3, I'm gonna do your nose. Good. Okay. Section 4, I'm going to have you close your eyes because I'm coming into your temple and your right eye. Good. You can open your eyes for a minute if you like. Yeah, I told you none of it would hurt, so I wouldn't lie to you. Section 5, same thing, coming into your temple. And over to your eye. Good. Only 3 more. Section 6, to do your right cheek. Great. Seven, left cheek. And finally, section 8, mouth and chin. Okay. Very well done. All right. So that is that for the swabs. And we'll have your results in 3 days usually. I don't anticipate you having any negative results come back. Sometimes if somebody has the presence of tinea versicolor or some kind of rash, then we expect something to come back with swab results, but for you, it's really just part of the process, okay? Alright, now I am going to do a quick sensation test on each part of your face just to make sure that your nerves are functioning properly. I have 3 things I'm going to be touching your face with. Grab those. So for the soft sensation, this little cotton round, I'm just going to be very gently touching your face with that, just a little tiny wisp. For the sharp sensation, it's not sharp, but we'll use the broken end of one of these wooden sticks. Don't worry, I'm not going to be giving you any splinters. It's just very little touch, so you can feel sharp sensation. And then for cold sensation, we have this metal tuning fork, and it feels quite cold, so you'll be able to feel that on your skin, okay? So let me just, we're going to start with soft, and I'm going to touch in each of the sections. So we'll start in section 1, okay? Let me know when you feel it. Good. 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 Very good. Good. Eyes closed. Good. 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 You can open your eyes again. Good. Good. Okay. Can you feel this? And this? And this? This. Good. How about here? Good. 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 Okay, so soft sensation is good. Now we will do sharp, and again, I promise it's not going to hurt, okay? Good. Good. Okay. Good. Good. Eyes closed. Okay. Great job. You can open your eyes. Good. Cheeks. Great job. Good. Mouth and chin. Good. Great job. So sharp sensation is good. Now I'm going to be doing cold sensation. Okay? Here we go. Good. Very good. Okay. That's just on your glabella. Good. Close your eyes. Good. Very nice job. I know this one takes good little while. Very nice. Alright, nose, and mouth and chin. Alright, and sensation of cold. Good job. Okay, now for this next part, I will be alternating the different sensations, and I want you to tell me what it is you feel. Soft, sharp, or cold, okay? And for this part, can you just close your eyes for me, please? Okay. So I'm just gonna come in a bit closer again, and tell me what you feel. Soft, sharp, sharp, cold, good, cold, good, sharp, good, cold, good, soft, cold, soft, cold, sharp, cold, sharp, sharp, soft, cold, soft, 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 cold, Okay, so you got every single one of those right. So your facial sensation is perfect. Okay, so now I'm going to do a little treatment for your face. We'll tailor it to the different parts of your face and their needs. I'm going to start with a little cleanse and peel. So it's this little solution. Comes in a dropper. And I'll be brushing it onto your face, okay? So I have my brush here. Getting some of this onto the brush. As you can see. Get that all nice and saturated. And this is a really cool, unique solution because it doesn't require any wiping or rinsing. It's just a cleanse and peel, and then we can put everything on top of it. Very, very gentle peel. Just removes the outer dead skin so that our therapy light and serums work a bit better, okay? So I'm going to come in and start on your forehead. It's nice and cool. Should feel a bit soothing. Okay. Coming down into your glabella. Good. Okay. I'm gonna put a bit more on here. Now we do avoid the eyes with this, so don't need to do anything to your eyes. Add a bit here. Has a really cool sort of milky gel consistency. And I'm gonna come into your cheek. Brushing that on. Make sure we get that on your parts that have a bit of acne up into your temples. Good job. This is totally hypoallergenic, so no worries at all about any reaction. It is great for sensitive skin. Works for everybody. Okay. And we'll do your other cheek. Great job. All right. I'm gonna go down your nose. Make sure to avoid your eye area, nostrils, and down into your mouth area and chin. We're not putting it on your lips. Just your upper lip area and your chin. Okay. Perfect. So we'll give that a minute or so to do its magic. After which point I will go ahead and come in with our therapy light. Now I am going to be treating you with blue light today. It's either, we can use blue and we'll use purple. And that is for the little bit of aging signs that I've seen. And we will also be using the red light, and that is for the little bit of acne and we'll also do that in the oily section. So I'm going to treat your forehead and glabella with the purple blue light. I will be treating your nose, cheeks, and chin with the red light. Okay. Yeah. And it is just this wand. So all I have to do is basically pass this over the sections that need treatment. And that will work for you if I can get it to turn on. There we go. Okay. So let me start with this purple blue light. And if there is light spillage to other sections of the face, it does not cause any harm whatsoever. I am just mainly treating the areas that need this the most, okay? So I'm going to start with your forehead. Okay, I'm just coming in here really nice and close. It's not harmful to the eyes, so you don't have to worry about that. But if you just want to relax, you can close your eyes and just relax. Passing that over the forehead. It's on the glabella as well, between your eyes. Okay. Very nice. Might feel a tad bit warm, but definitely not uncomfortable. It's very effective, but also very gentle, so. Good. Very good. Okay. Looking great. Alright. Okay. Now, we'll do this lighter blue light. Does the same type of stuff, but this one has a different wavelength, so it gets more of the surface wrinkles, whereas the purple kind of got more of the deeper wrinkles, okay? You're gonna need a nap after all this, I bet. Or maybe a nice big lunch to treat yourself. You've been here for quite a while. Okay. Alright, very good. Okay. Okay, here's another purple, more of a lilac. Same thing, just a different wavelength again. We won't use this one for too long. Good. Okay. Excellent job. Alright. And our red light. Okay. So, changed on me. There we go. Our red light. So the red light is really just for nose and cheeks, okay? Just get in here on the nose. Oh, and the chin, sorry. And the chin. Very good. Down your cheek. Good job. Really making sure to get in on these spots with acne. Great job, okay? Other side too. Right, chin again. do this for very long because it is quite powerful. Okay, great job. Alright, turn that off and put it away. Alright, so the next step, I am going to put a serum on your face and a nice lightweight moisturizing lotion, okay? So I have to start with this Restore Serum. It is a solution of niacinamide and zinc. This can calm your skin and promote healing. Really good as an after treatment for what we've just done. I'm going to put this right on my hands. Okay. And I'm going to smooth this into your entire face. This is good for all skin types. Any issues, so go ahead and put it on your whole face. We are avoiding the eye area, okay? Into your chin. And down your nose. Alright. And I am going to use a very lightweight moisturizing lotion as well. I have it right here. And we'll put this over. Gloves off. Now, as a part of your face mapping face exam package, I do have products that will be sent home with you. So the first thing we're going to send home is the niacinamide and zinc serum. This can be used every morning on your whole face before moisturizer. So this will help with retaining moisture. Again, it will help with calming your skin. It also helps with blemish-prone skin, so it really is a great fit for you. So you just put a couple drops that goes over your whole face, followed up by one of my favorite facial moisturizing lotions. This is the CeraVe facial moisturizing lotion with an SPF. So I would recommend using an SPF in addition to this, but this is a really nice day lotion. So this, again, all over your whole face. Now at night, you will rotate between two different serums. So do not use these on the same night. They don't play well together. We have a lactic acid 10% plus hyaluronic acid. So this is going to help with mild exfoliation. It will help with any dead skin. It's going to help with the acne as well. So the lactic acid is sort of the peeling solution. Hyaluronic acid is more of like a moisture retention agent. So very, very, very good for your type of skin. That can, again, whole face minus the eye area. I would do this 2 or 3 times a week. Start with 2. If you find that you're not sensitive to it at all, 3 times a week. And the other is this Granactive Retinoid 2% emulsion. This also helps with a little bit of exfoliation and very good for those fine lines. So very good for anti-aging, As you can see, this one looks a little bit milky. So you have that sort of milky consistency. And again, a couple drops, whole face minus the eyes. The hyaluronic acid is a lot more watery. So if we see, much more watery. And the niacinamide and zinc was pretty watery as well. Now, after you do, so 2 times a week to start. If you find that it's working very well for you, no sensitivity, 3 times a week. So 3 times a week for this, 3 times a week for this. And on that day that you don't use either one, you can use this at night as well. And after you do your serum at night, you will use this nighttime moisturizer. So this is also CeraVe Facial Moisturizing Lotion PM. It is very hydrating, but also very lightweight. It has niacinamide and hyaluronic acid to help protect your skin's barrier and retain hydration. So this can go face and neck, as well as this. So this is morning, this is night, obviously. Okay. So for your eyes, really liking how your eyes look, so you can continue using your current eye cream. Another good option would be CeraVe's eye cream. Really like their line. It's very affordable, has great ingredients. So we actually will have a bag for you at the front desk with all of these products new. And that is part of your exam here. So I would like to see you back in 4 weeks of trying this treatment to see how everything looks. Make sure that we only see desirable changes in your skin. All of these products are very mild and determined to work well with your skin. But if you do find that something is causing any irritation, rash, itchiness, burning sensation, very, very rare, but make sure to contact me right away because I want to get you in and evaluate what's going on and get you different products, okay? Perfect. So we'll have all of those for you in a bag up front. I will have your test results in 3 days. Don't expect anything negative. We'll give you a call either way to let you know. Any questions? Yes, we'll have a full write-up of your routine also in that bag so that you know exactly what you're doing when you get home. Anything else? Okay. Well, it was a pleasure to meet you. I am going to step out and it'll be about 5 minutes. The nurse will come and get you, bring you to the front desk, and they'll have those products ready, as well as the ability to schedule your 4-week follow-up appointment, okay? Alright, so you can just relax in here until then. Very nice to meet you. Can't wait to see you again. Bye-bye.